This is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, giving our update for November 18th, 2021. This is our chance for us to answer questions that people have submitted over the week, and we have a few of those today, as well as a chance for us to go ahead and give updates on what's happening with COVID locally, in the state, in the country level, and also at the world level. So let's start at the world level. Well, at the world level, we are definitely seeing an increased number of cases of COVID. Most of these are in the northern parts of the world. So almost all of the places that are having big outbreaks now are in places above the 40th parallel. So north of where we're at and a little bit north. So the big outbreaks now are in Russia, in Eastern Europe, and it's beginning to spread to Western Europe, where we're seeing an increased number of cases in Austria and in Germany. This is a little worrisome because these are mostly, again, Delta cases, but again, they're really spreading in those areas, and some of those areas have now had real crunch on their hospitals. So as much as we think that our big peak last month and the month before was the end of this, it probably is not. So that is a bit worrisome. So cases in the world are up, deaths are about flat. So we're a little worried from the world point of view. In the US, what we're seeing is those places that had a lot of disease in August, September, in the southern part of the country are now pretty quiet. But we are seeing in our country, too, a real spreading cases in cooler places, Maine, New Hampshire, Vermont, upstate New York, Michigan, Wisconsin, Minnesota, and North Dakota. So those places which are now already really cooled down and people are spending more time indoors are seeing an increase in number of cases. Not yet seen that in Oregon. Oregon is pretty quiet. We've had a declining number of cases for the last 2 months or so, and we're also seeing a declining number of hospitalizations. Now, some of the deaths we're seeing are older deaths that are reported, but the current death rate is pretty low. In Douglas County, we're kind of stable. We're at about 30 cases per 100,000 per day, which is really high, higher than we'd ever been before, but certainly down from where we were earlier. We're having between 20 and 30 people in the hospital a day. Many of those are new people. People who are just getting the disease now who are getting hospitalized, but some are people who have been sick for a really long time who still stay in the hospital. We've had some good success over the last week. Some of our most chronic and sickest patients are getting better. One got discharged this week, and a couple have been moved down to a lower level of care. So that's all good news. But some of these have been in the hospital for a very long time, and they're going to have a really, really, really long recovery. So we're worrying about that. In terms of vaccinations are widely available. We have all of the different kinds, the 3 different kinds for adults, the Pfizer, the Moderna, and the J&J. We have boosters for adults of the Pfizer, Moderna, and J&J, and we've got now the pediatric vaccine that's available. This pediatric vaccine is being given. We've given, I think, over 100 by this point, not seen any unusual side effects. They're being given at the bigger clinics, Aviva, Evergreen, Health Alliance, and Adapt, and each of the pediatricians in town have access to that vaccine. So for kids who want to get the vaccine, call the place where you normally get your vaccine, and we should be able to get the vaccine for you and your kids. So vaccine still seems to be very effective. When we look at our daily hospitalization rates, the overwhelming number of people in the hospital are unvaccinated, and yet the majority of adults, about 60% of adults, are vaccinated. So the risk of being hospitalized is 6 or 10 times greater if you're not vaccinated than if you are. So again, the vaccines work. They're still effective even against the Delta variant. So what we're asking people to do is, if you've not got vaccinated so far, please go get vaccinated. There's a couple of new things out. One of the questions we got this week is about the new antiviral drugs. So both Merck and Pfizer have come up with antiviral drugs to treat the virus, typically at the early parts of the illness, and decrease your risk for hospitalization and death. We have a lot of other antiviral meds. We have antiviral meds for the flu. We have antiviral meds for hepatitis C. We have antiviral meds for HIV, all of which are really quite effective and really helped us to manage those diseases. If we can get these antiviral drugs that are safe and effective for COVID, that'll really change things. That'll tremendously decrease the number of people that get hospitalized and tremendously decrease the number of people who die. And that's really got to be our top goals here. People have asked whether you can use the antiviral drugs and the Regeneron together. Don't know the answer to that, although I think we'll get some guidance on that in the future. There's no biologic reason that you shouldn't be able to use both together, but we'll see what they decide on that. Another question that's come up this week is, what do we do for the holidays? Well, I think for people who are vaccinated and don't go to a party where people are sick, you can probably resume normal Thanksgiving and Christmas visits. However, people unvaccinated really increase the risk, and for people who attend while they're sick, increase the risk of getting you sick with whatever they have, be it COVID or just typical cold. And so really stay home if you're sick. If you're going to this thing, even if you've traveled a long way, if you wake up sick that day, please stay home. While people really appreciate your company, they will not appreciate getting sick. And if you can get vaccinated before you go, that's great. Now, you can't get fully vaccinated before you go, but even one dose of vaccine will give you considerable protection. The next question we got this week is about the Regeneron. So Regeneron is our laboratory-derived antibodies. They were first released in tiny amounts in the fall of this year, and that's President Trump got the Regeneron. He credited that with his recovery. It's hard to know, but we've seen that we've given over 700 doses here in Douglas County, and it appears that the people who got the Regeneron are much less likely to have been hospitalized than people who did not get the Regeneron. We're still crunching through the data, and we'll get the final results soon, but it does look like Regeneron is another step in preventing hospitalizations, deaths. So if you do have COVID, get tested positive and are in a high-risk group, talk to your doctor about getting the Regeneron. It can be done either as a 1-hour infusion or it can be done as a shot, and both seem to be effective in reducing your risk of hospitalization and reducing your risk of death. So the good news is a lot of vaccine, a lot of safe and effective vaccine. We're starting to now get some treatment. If you do get infected with Regeneron, soon we may have treatment with the Pfizer pill. So things are so much better than they were a year ago. Remember, a year ago, at this point, we had no vaccine, no treatment, and it was pretty grim. I think it's much better this year, and I'm hoping by this time next year, we're not even having these calls anymore, because COVID is probably not going to be passed, but it could be to the point where it's an uncommon disease that we treat. And we've got a lot of diseases that we treat. I mean, every day we have people with pneumonia and meningitis, all kinds of other things that we treat, and you don't hear much about that, because those diseases really don't overwhelm the hospital system. There's not really much you can do to prevent them, and they have a relatively low death rate. So that's hoping where we'll get with COVID, and that's totally what I want for Christmas next year. One of the later questions that's come up is about testing. Testing is still available. The pharmacies have been doing a lot of testing, but they've been quite busy, and so testing has gotten a little shorter. There are these home tests, which are called Binax, which are really quite good. In addition, we're working with a group from McKinsey Willamette. They're going to be testing here in Roseburg every Friday afternoon in that lot across from the library, across Fowler Street, and they're going to be doing a PCR test. So they'll do the test on Fridays, and you should get the results back by Monday. These tests will be helpful for people who are symptomatic and want to know, or for people who would require a test for employment or other reasons. And so that's another resource that's going to be here. They're going to be there in that lot across the Fowler Street from the library every Friday, at least through the end of this calendar year, and maybe longer if we need it. That's what I have for today. Again, if you have questions, please send them to Facebook questions at DouglasPublicHealthNetwork.org, and we'll go through those next week. Again, this is Dr. Bob Dannenhoffer, Public Health Officer of Douglas County, for November 18th, 2021. Thanks.